Welcome, everybody. I'm Dr. Elizabeth Edgerly. I'm the Chief Program Officer for the Alzheimer's Association, and it's my pleasure to welcome you today to the 16th Annual Updates on Dementia Conference, which is a little mind-boggling for me because I've been here for every single one of those, and some of the rest of you have as well, because I know some of the faces in the audience. I'm curious, though, how many of you are here for the first time today? Well, welcome. It's great to have you. You can join the club and come back next year and the year after. It's interesting to think about this partnership because this conference actually does represent a partnership between different agencies. It started with the VA and Stanford originally, that they were offering this conference to help bring the latest in research and practice to those of us who were working with individuals with Alzheimer's and their families. And it was probably about 16 years ago when my friend and colleague James DeAndrea, who was at the VA organizing it, said, you know, I don't think we're going to do it anymore. It's a lot of work. And the Alzheimer's Association, essentially I, said, no, we need this. There's not anything quite like this out there that you can count on for every year being able to come back and hear from some of the best scientists, some of the most experienced experts in the field, and know that the quality of the information is high and trustworthy. And that's not always that easy to get. When it comes to Alzheimer's in particular, there's a lot of misinformation. So welcome to all of you. I wanted to start you off this morning with a video from the Alzheimer's Association. Some of you may have seen these in years past, but every year the Alzheimer's Association produces a facts and figures report. And along with that, for the past several years, we've produced a brief video. And the video tends to be 90 seconds to 2 minutes, and each year there's a different theme. So I wanted to share this video with you, and before I show it to you, I also want to mention that if you're like me and you speak on Alzheimer's on a semi-regular basis and you would like to use this video, we encourage you to use it. If you want to share it with families with whom you're working with patients, with colleagues, that's what it's there for, is really to help spread the word about how many people are affected and what Alzheimer's is doing in the United States today. So Tom, if you could show the video. Some of these statistics are staggering, aren't they? When you see that for women over the age of 60, that we are twice as likely to develop Alzheimer's as we are breast cancer, and we don't necessarily recognize that. So I invite you to get involved in the movement to defeat Alzheimer's in various ways, and the good news is there's lots of ways to get involved. So I'm curious how many of you have ever participated in the Walk to End Alzheimer's. Any walkers out there? Woohoo! Well, you may or may not know that we are the largest chapter of the Alzheimer's Association in the country, and we run some of the largest walks in the country. And it's interesting because many times people think that going to a walk about Alzheimer's is sort of a depressing thing. You know, it's sad. It's a sad disease. But after having gone to, oh gosh, I don't know how many walks, many walks, probably 30 walks, I have yet to go to a sad walk. It's quite the opposite. When you bring people together who are facing adversity and a shared experience, it's incredibly uplifting. And to know that you're part of that, to me, is just a wonderful thing. So I invite you to join us at a Walk to End Alzheimer's and have a team. There are also some other areas that we are focusing on, and you'll be hearing today from our speakers about various research trials, clinical trials taking place throughout the Bay Area. And one of the issues after funding and the lack of funding, one of the barriers to creating a world without Alzheimer's is the lack of subjects. And so the Alzheimer's Association is trying to help scientists to address that by developing what's almost like a dating service, a little matching service between, let's see, gee, Gail, you're interested in this study. Well, I know some nice studies over here that might work for you. And so helping you to figure out what you would qualify for. And then you see what you're interested in. And then it's up to you to go from there. I did it myself and qualified for a study within about 5 minutes and participated in a long-distance caregiver study, and I didn't even consider myself a caregiver. I always complain about caregivers not doing that they don't see themselves as caregiver, and then I did the same thing when caring for my mom. So I encourage you to participate, and there's information in your folders about this, so you can look through this and find the trial match info. Another announcement I want to share with you is today, May 6th, is the Day of Giving. And I don't know if any of you have heard of this before. It's new. The Silicon Valley Community Foundation is trying to support local nonprofits. And so many of the partner agencies here today, 5 of us in all, are actually benefiting from this. So if you're interested, check it out. You can donate to the Community Foundation, and they then give it to local nonprofits. So it's a really wonderful partnership, and we're very pleased that they're doing that. I'd like to thank our sponsors. So first, our presenting sponsors, Sequoia Hospital Dignity Health for the first time. We received a grant from them, and we are so grateful for their support. And also to Silverado, who sponsored one of our speakers, Chris Nowinski. Thank you, Silverado, for your support. We also have primary sponsors, and there are exhibitor tables, and we encourage you to check these out. CPMC Brain Health Center, part of Sutter Health up in San Francisco, wonderful partners. Semino Care, Home Instead Senior Care, and Nurse Registry. All of you, thank you so much to our sponsors for supporting us here today. Also, to the Tsai family and the staff of the Crowne Plaza Hotel. We've been here for many years, and in large part, it's because of the Tsai family and how wonderful they are to work with. I'd also like to specifically recognize our friends, the Ombudsman of San Mateo County, for sponsoring the breakfast that you're having today. Thank you to the Ombudsman. And yes, let's have applause for the food gets applause. And I want to recognize the members of our planning committee and our partners. I'd like them all to stand if they're in the room. So we'd start with Allison Rosen at the MIREC and the VA Palo Alto, Pauline Martinez and Blanca Vasquez of the Alzheimer's Association, and they may not even be in the room because they're out there working. Dolores Gallagher-Thompson of the SGEC, hopefully Dolores is here. Michelle Venegas of Family Caregiver Alliance, and Terry Hutt, the GREC VA Palo Alto, and then myself at the Alzheimer's Association. So thanks to the planning committee. So with that, I want to have Tippy Irwin from the Ombudsman of San Mateo County come up and introduce our morning speaker.